Hi, everyone. So, I had 33 abstracts to go through, not as my um, partners here with 89 and 100 and something. So, I had a bit of an easier task, I think. I made a word cloud using the abstracts, and basically, these are the most prominent words that came through. And what is the center of policy reform? It's people, health, care, services, harm reduction. I think it's a perfect depiction of where we are at and where we are leaning towards. And because policies should serve humanity, should serve people, not bureaucracy. So, okay, I must look here. So I had four themes. The first one was linkage to testing and care, looking at the barriers and the enablers. Then, following that, was developing and facilitating implementation of programs, which included testing services, intervention on the needs at the individual and community level, looking at hepatitis, care and testing, HIV and needle syringe programs, OST programs, etc. And then, oops, sorry, um, approaching stigma and as well as approaches to influencing policy. So, lots on that slide, but just I wanted to give everyone an opportunity, if you didn't have a look at any of the posters or presentations within this track, just to summarize it for you. But the linkage to testing and care, specifically community-based models for access and equity. So basically, its efforts to improve linkage to testing and care highlights the importance of bringing service to where people are at through community-based, peer-led, and flexible models that addresses social inequities. So Yolan, Nadir, Kimberly, Sophia, Vuyoko, Igor, James, Grace, Juliam, Alexandra all spoke about improving accessibility, exploring barriers and facilitators, looking at solutions, how to link, understanding the care standards, creating awareness, and just trying to understand and provide services for people in need. And then secondly, developing and facilitating the implementation of programs based on the needs at the individual level and at the community level. So Joshua, Kimberly, Viviana, and Charles and Shatyam all spoke about preferences, looking at age, gender, injection history, um, including local practices, the type of needles or syringes, how harm reduction services are accessed and how they're utilized, and at the community level, addressing structural inequities and tailoring testing and care models, which are essential for equitable access and improved outcomes. And then just to share one or two, Viviana spoke about in terms of preferences where there were two regions and they prioritized differently. One looked at convenience and the other region looked at safety and sterility and different drug use practices, showing the importance of understanding the community that you are trying to serve. And then Suwan at the community level spoke about having one framework in two prisons and looking at the barriers and solutions of both prison settings and applying one framework and having two completely different models of care. And then approaching stigma. Stigma was a theme across the tracks, I think. But issues like law enforcement harassing individuals continually being a barrier to access of services, removing of their syringes, etc. Marie spoke about the violence against health professionals in harm reduction work and also about the emotional impact of the client's narratives on the health professionals, mental health. Jules spoke about the impact of the decriminalization policy and how that impacted stigma and found that it didn't have much change, that additional work is needed. Hanifa spoke about the impact of mental health on improved access to care and services like PrEP. And Carla held a workshop where they spoke about the state of the art of stigma, understanding stigma, and sharing how it impacts the delay in access, and when people are accessing treatment or health services, that there's non-disclosure because of fear of stigma. And Angie also spoke about changing the narrative, how we think, how we speak, and have it be through a gender transformative lens. Then this was my favorite one, direct approaches to influence policies. And really, this global harm reduction service efforts face major gaps with limited coverage of needle syringe programs, drug consumption rooms, and uneven funding priorities favoring punishment over health. Strategic budget allocation, evidence-based investments, and policy reform are essential to improve equity and reduce HIV and hepatitis transmission. Gaj and Siwapon, Kiki all spoke about showing the cost effectiveness of having a harm reduction program. So it was all about actionable steps in how to inform policy. And using the cost effectiveness to show that. Gaj also spoke about the gaps in data and in monitoring, spoke about the fact that there's, in 93 countries, there's needle syringe programs available. However, 190 countries report injection use. And then Marlies spoke about the creating of actionable roadmap to the decriminalization of drugs. And then Julian again had a workshop on the implementation science and shared how that is the best scientific method to support the integration of evidence-based interventions, programs, and policies into health and to encourage uptake. So basically, this is me summarizing all of the sub-themes that I came up with, and also taking into account the drug policy workshop that I attended. That was phenomenal. And just to say, across the themes, there's been the talk of we need more evidence, we need more data. And so just the continued collaboration between civil society and research institutions. Monitoring should support and not obstruct. It shouldn't be a checklist. It should be about the quality of the services. Barriers are different across individuals, across communities, and across regions, and guidance is good, but implementation needs to be tailored to those barriers and needs to the population, and to lean in on the sources of resilience in the individual and within the community. Include personal preferences as a manner of encouraging implementation of needle syringe programs. Ensure sufficient pre-implementation work and building of strategies to support policy changes. And what is pre-implementation work? It's engagement with stakeholders. It's understanding stigma within that population or community. It's doing a needs analysis, understanding what the population's needs are. Sensitization of policymakers in the South African context, that is the Department of Social Development, of Health, of Justice. It includes law enforcement, educators, and it looks different in each country. Again, the importance of stigma, understanding stigma, what kinds of stigmas that individuals are facing, and understanding from both perspectives. Build alliances with populations and organizations, and definitely include people with lived experiences. Align, map, link substance use issues with the local and national social or health issues. And lean in on mapping out the long-term financial gain. And then lastly, just to continue to fight HIV and hepatitis and not people who are using drugs by shifting public narrative from moral judgment to compassion and public health perspectives, which will lead to an ethical, human, and political approach. Thank you.